Sussman joins us now to raise our awareness about a common health problem that impacts nearly 40,000 men. Well, Dr. Sussman, first of all, welcome, and can you tell us, please, what is BPH?
Well, BPH is benign enlargement of the prostate, and it affects men as they get into their 50s and 60s and beyond. I think, and the number is really 40 million men, and it causes symptoms of decreased urinary flow, hesitancy, and most bothersome, nighttime urination.
Now, there was a recent survey. Can you share some of the results of that survey on this particular subject?
Certainly. I think what's interesting is that the majority of men really don't seek treatment because they're afraid of some of what we're going to offer them in terms of either medication or surgery. They're worried about the sexual side effects. They're worried about urinary incontinence. In addition, we've learned that what bothers them even bothers their spouse more. And when they're getting up 2, 3, 4 times a night, it's their spouse that's equally as bothered. And oftentimes it's the spouse who says to the husband, listen, it's time to see somebody. You know, you're up all night long, and I'm up with you. And this is a quality of life issue that's quite significant and very impactful for both the patient and their partner.
Well, and let's talk a little bit about the health impacts of broken sleep. What kinds of health issues does that cause?
So I think, as I mentioned, one of the biggest things is that people are tired the next day. So if people are working, they're not productive at work, they really have no energy. It can lead to depression. These are pretty common issues, and again, it transmits to the spouse or significant other as well, because they're impacted, their sleep is affected. So I think you can imagine that the quality of life for both the couple is dramatic. So we've really been out there encouraging people and men to seek help for the urinary symptoms because we have new technology that's easy to undergo, treatment in the office to impact urinary symptoms. People are back to activity fairly quickly without the classic side effects of urinary incontinence or sexual dysfunction. It's called Urolist, and it's really changed a lot of what we do in urology, and I think in a very positive way.
I was looking at a video there. How is this treatment applied?
So it's done in the office setting, usually with some sedation, and what it does is it's really a mechanical solution to a mechanical problem. It actually separates the prostate tissue, thereby creating a larger channel to urinate through, and by doing so, it improves urinary symptoms. Men have a better flow, less hesitancy, they empty their bladders better, and most importantly, they get up at night less often. So this is a procedure that really has revolutionized how we treat men and their urinary symptoms from BPH, and again, without those really bothersome side effects of sexual dysfunction or urinary incontinence.
Are those procedures, or is that procedure available all across the United States?
It is. This has been around for some time now. About 60,000 patients have been treated. We have 5-year data to support the benefits long term. And yes, it's approved by the FDA. It's covered by most insurances. And I think as men speak to the urologist, this will be one of the discussion points that they will have, are these minimally invasive ways to treat BPH symptoms.
Where can you send our viewers for more information?
Certainly. There's a really good website called Urolist.com. It talks about BPH in general. It reviews the procedure. There's also a brief questionnaire that the person can take about their symptoms and maybe find out whether they should be seeing a urologist to discuss treatment for their urinary symptoms.
Dr. Sussman, thank you so much for being with us today.
My pleasure, Angie.
And we'll be back with more local lifestyles right after this.